Top health experts say the country is facing an incoming tidal wave of COVID cases. The fast-spreading Omicron variant has been detected in at least 44 states. Now leaders are scrambling to stop the spread as people gather for the Christmas holiday. Debra Alferone has the latest from the White House.
Los Angeles has canceled its New Year's Eve celebration in Grand Park because of COVID. Boston's mayor announced a brand new vaccine mandate for restaurants, gyms, and sports venues. And the mayor of Washington, D.C. has reinstated a mandatory indoor mask policy.
2, 1, Happy New Year!
However, the Times Square New Year's Eve countdown is still on for now. The 2022 digital board arrived Monday, even as New York City grapples with a record-breaking number of cases.
We did not expect Omicron to move quite this quickly.
Nationwide, average new daily COVID numbers have nearly doubled since the beginning of November, with an average of 156,000 cases a day. From Minnesota to Florida, California to New York, lines for testing are long, and home test kits hard to find.
We are going to see a spike in cases, and that's because Omicron is incredibly transmissible. But there will be a stark difference between the experience of those who are vaccinated and boosted versus those who are unvaccinated.
President Biden will address the nation tomorrow, and he's expected to issue a stark warning to unvaccinated Americans. He's also expected to outline new steps to help communities struggling with new caseloads.
We continue to see, and our health experts assess, that you're 14 times more likely to die of COVID if you have not been vaccinated versus vaccinated.
Among those who've been caught up in this most recent surge, Senators Elizabeth Warren and Cory Booker, U.S. Representative Jason Crow from Colorado, and Maryland Governor Larry Hogan all say they are vaccinated and boosted and only experiencing mild symptoms. Today, Moderna released new data that shows a third shot increased antibody levels 37 times. Debra Alferone, CBS News, the White House.
Joining me now with more is Carl Zimmer. He's a columnist at the New York Times writing about science and author of Life's Edge, the search for what it means to be alive. Welcome, Carl. So what are we learning out of South Africa about the rapidly spreading Omicron variant, where it was first identified?
Well, what we're seeing there is that this variant can spread really fast, faster than any variant we've seen before. It looks like it actually may have even peaked in South Africa, which might give us a sense that this will be a really fast, intense surge, but maybe not as long of a one as we've seen elsewhere. But you really have to see how the variant behaves as it goes from country to country.
Well, if the Omicron variant causes less severe infections than the Delta variant, why is it still likely that this surge could overwhelm hospitals?
We don't know yet if it causes milder infections. That is still wide open. It would be great if it did, but on the other hand, you know, if imagine that the Omicron variant only sends half the percentage of people to the hospital that the Delta variant did. Well, what happens if we have 4 times more Omicron cases? Then you have twice as many cases in the hospitals. And so epidemiologists are very concerned that we could, because it's spreading so quickly, that we could have a massive surge into hospitals that they just aren't ready for.
Well, a new study of some 30 million people shows roughly 4 in 10 people who get infected with COVID are asymptomatic. Carl, what might that mean for the pandemic going forward?
That means that this is a really hard virus to fight, because you can't just rely on symptoms. You know, you can't say like, oh, I feel terrible, I'll stay away from people. No, actually, you might feel fine and get lots of people sick. And so what that means is that we have to go to lots of measures like not just vaccination, but also reducing the amount of contact that people are having to slow down the spread of this virus.
So the White House has touted expanding free at-home testing for Americans. Why is it still so hard, Carl, especially for people in big cities to get tests?
This has been a problem over the past year. Testing experts have been warning us that this is going to be a problem. The government hasn't done enough to make tests affordable and widely available. You just need to look to Europe, where tests might cost $1 or they're free and they're in great supplies. When people in Europe look at us and see that we're scrambling around trying to find a test, they just scratch their heads. It's kind of absurd.
Well, the Netherlands went into a full lockdown on Sunday in response to the highly contagious Omicron variant. There are protests spreading all over Europe. How is the virus spreading there in comparison to the U.S.?
Omicron basically is a few days or weeks ahead of us in Europe. So if you want to see what it's going to be like in the United States, look at Europe.
All right. And finally, you know, a lot of parents out there are looking for answers on vaccinations for their kids who are just too young to get them. So where do things stand with respect to vaccines for children under the age of 5?
Well, Pfizer recently reported that they had done a trial with kids 5 and under, and they were using 2 doses. And unfortunately for the kids between ages 2 and 5, they just didn't produce enough antibodies in response. And so they're going to be going back to run another trial where they give them a 3rd dose. This happens all the time in vaccine development. Unfortunately, we want everything to go perfectly. And, sometimes there are these situations where they have to try again. So unfortunately, that means that for parents who have kids 5 and under, you're going to have to wait maybe a few weeks or months more.
All right, Carl Zimmer. Carl, good to see you again. Thank you very much.